Hello guys, welcome to my channel CNA Practice Lab. This quiz is number 2 from Fall Prevention. These questions are designed to help you prepare for the CNA exam with real-style scenarios. Pause the video, think carefully, and choose the best answer before moving on. Let's get started.
Question number 1. Which device alerts staff when a resident tries to get up? A. Bed alarm. B. Pillow. C. Blanket. D. Wheelchair. The correct answer is A. A bed alarm alerts staff when a resident attempts to leave the bed without assistance, allowing quick intervention. Pillows and blankets provide comfort but do not monitor movement. A wheelchair is a mobility device, not an alert system. Bed alarms help prevent falls by notifying staff before a resident walks unsafely.
Question number 2. A fall risk assessment includes checking which of the following? A. The resident's hobbies. B. Balance. C. Favorite food. D. Fidget schedule. The correct answer is B. Balance assessment helps identify instability and mobility problems that increase fall risk. Resident hobbies do not directly affect physical safety. Favorite food has no connection to falling. A fidget schedule does not assess balance or mobility and is not part of a fall risk assessment. Question number 3. Which of the following is a behavioral fall risk? A. Vision loss. B. Dizziness. C. Strong grip. D. Excellent balance. The correct answer is B. Dizziness affects body awareness and stability, increasing the risk of falls during standing or walking. Vision loss is a sensory impairment, not a behavioral risk. Strong grip improves safety during transfers. Excellent balance reduces fall risk rather than increasing it. Question number 4. Environmental hazards include which of the following? A. Well-lit halls. B. Clear walkways. C. Loose rugs. D. Call light within reach. The correct answer is C. Loose rugs can slide or bunch up, creating a serious tripping hazard. Well-lit halls help residents see obstacles clearly. Clear walkways reduce the risk of tripping. A call light within reach encourages residents to ask for help instead of walking alone. Question number 5. If a resident stumbles but does not fall, you should A. Ignore it. B. Report to the nurse. C. Laugh it off. D. Wait until the next shift. The correct answer is B. A near fall indicates increased risk and must be reported so the nurse can reassess safety needs. Ignoring it may allow a future serious fall. Laughing it off is unprofessional and unsafe. Waiting until the next shift delays intervention and violates proper reporting procedures. Question number 6. Which footwear helps prevent falls? A. Slippers. B. Non-skid socks. C. Bare feet. D. Loose shoes. The correct answer is B. Non-skid socks provide traction and reduce slipping on smooth floors. Slippers may slide or lack support. Bare feet increase the risk of slipping and injury. Loose shoes can cause tripping and poor stability. Question number 7. A key prevention strategy is A. Raising bed height. B. Blocking paths. C. Turning off lights. D. Keeping the call light within reach.
The correct answer is D. Keeping the call light within reach allows residents to request help instead of walking alone. Raising bed height increases fall risk when exiting the bed. Turning off lights reduces visibility, especially at night. Blocking paths creates obstacles that increase tripping hazards. Question number 8. A resident with poor vision is at risk for falls because A. They see better, B. They misjudge steps, C. They run, D. They hear better. The correct answer is B. Poor vision makes it difficult to judge distances, steps, and obstacles, increasing fall risk. Seeing better is incorrect by definition. Running is not caused by vision loss. Hearing ability does not compensate for visual safety hazards.
Question number 9. Should side rails be used to prevent falls? A. Always. B. Never. C. Only with consent. D. Only at night. The correct answer is C. Side rails can be considered restraints and require consent and proper justification. Using them always or never ignores individual resident needs. Time of day alone does not determine safety. Proper assessment and consent ensure ethical and legal use.
Question number 10. A scheduled toileting routine helps prevent falls by A. Increasing independence, B. Reducing unassisted movement, C. Making the resident wait, D. Limiting fluids. The correct answer is B. Regular toileting reduces urgent, unassisted trips to the bathroom that often lead to falls. Increasing independence alone does not address safety risks. Making residents wait can worsen urgency. Limiting fluids can cause dehydration and is unsafe.
Question number 11. What should a CNA do after a fall? A. Report to the nurse first. B. Ignore it. C. Wait some time. D. Comfort only. The correct answer is A. Reporting the fall immediately allows the nurse to assess injuries and update the care plan. Ignoring the fall is unsafe and negligent. Waiting hours delays medical evaluation. Comforting alone is not sufficient without proper reporting and assessment. Question number 12. Promptly answering a call light helps prevent falls because A. Resident stays busy. B. Resident remains alone. C. Resident does not walk unassisted. D. Nurse isn't needed. The correct answer is C. Promptly answering a call light prevents falls by stopping residents from trying to move without assistance. Quick response ensures help is provided safely and reduces the risk of unassisted walking.
Question number 13. A CNA notices that a resident frequently attempts to get out of bed without using the call light. The resident is unsteady and has a history of falls. What is the CNA's best immediate action to reduce fall risk? A. Remind the resident to be careful when getting up. B. Place the call light within reach and remind the resident to use it. C. Apply non-skid socks only during daytime hours. D. Ask the nurse to restrain the resident. The correct answer is B. Placing the call light within reach ensures the resident can call for help safely. Reminding them alone is not enough, and restraints or socks do not directly prevent unassisted movement. Question number 14. During rounds, a CNA sees a resident attempting to walk to the bathroom without a walker, even though the resident has been instructed to call for assistance. The floor is clean, but the resident appears weak. What should the CNA do first? A. Walk beside the resident and allow them to continue. B. Immediately assist the resident and notify the nurse. C. Tell the resident to return to bed alone. D. Document the behavior after the resident sits down. The correct answer is B. Assisting the resident immediately prevents a potential fall and ensures safety. Walking beside them or telling them to go back does not provide proper support. Documentation alone does not prevent harm. Question number 15. A resident uses the call light, but staff response is delayed. When a CNA arrives, the resident says they were about to stand up alone. Why is prompt response to the call light essential in fall prevention? A. It reduces staff workload later. B. It keeps residents occupied. C. It prevents residents from attempting unsafe movement. D. It replaces the need for an assistive device. The correct answer is C. Prompt response prevents residents from attempting to move without help, which is a major cause of falls. Staff convenience, keeping residents occupied, or skipping assistive devices do not prevent falls.
Thanks for watching this fall prevention quiz on CNA Practice Lab. Review your answers, keep practicing, and stay safe while caring for residents. Don't forget to like, subscribe, and check out the next quiz.